Welcome back. We've heard a lot about COVID-19 being a respiratory illness. However, today in our Surviving COVID, Controlling Your Risk Factor segment with Doctors Hospital Health System, we want to get a better understanding of gastrointestinal symptoms as part of the clinical picture of COVID-19. This morning, we have Dr. Sheena Antonio-Collie, Chief Medical Officer of Doctors Hospital Health System, and Medical Director of Doctors Hospital West, Dr. Beverton Moxey, Gastroenterologist of the Doctors Hospital Health System. Good morning and welcome back to Bahamas at Sunrise.
Good morning. Good morning.
Good morning.
I'm always excited to have doctors on. I feel like there's so much knowledge just gonna pass through the screen into my mind. So I always enjoy having you guys on. So, Dr. Collie, we always like to highlight the staff that work along with you. We know that Dr. Moxey is a highly respected gastroenterologist and internal medicine physician. Tell us what an asset he is on the Doctors Hospital team.
Absolutely. Dr. Beverton Moxey is a board-certified internal medicine specialist, as well as a gastroenterologist who completed his fellowship at the Cleveland Clinic in Florida. He is also the medical director of our medical surgical unit, and of course, brings high value in the field of gastroenterologists, having worked with numerous patients with COVID, and early on in the pandemic recognized that there was a connection between some of the gastroenterological symptoms that we were seeing and COVID, having patients that presented that way. So he is definitely an asset. Many of our COVID positive patients are treated on the unit that he is the medical director of, and definitely does bring value in terms of that specialized and that expertise in that field.
Yes, one of our local Bahamian all-stars, Dr. Moxey. So tell us, what is the gastrointestinal tract and what symptoms have you seen in patients diagnosed with COVID-19?
Okay, so the gastrointestinal tract refers to anything from the mouth to the anus. And so that includes your esophagus. So when you eat food travels down the esophagus into the stomach. It then enters into the small intestine, and then it goes where the process of digestion occurs. That's where you absorb all of the nutrients from the food that you eat. And then it enters into the large intestine, where it then exits the body through the rectum and, as waste. And so some of the symptoms that we've been seeing in persons with COVID-19, some patients actually do not present with the typical respiratory symptoms that we're accustomed to hearing patients present with: the fever, the cough, the shortness of breath. Patients typically or can present with only gastrointestinal symptoms. And what we're seeing, some of those symptoms, you may notice patients complaining of abdominal pain, they're complaining of nausea, vomiting, poor appetite. They may be complaining of diarrhea, which is a big one, and abdominal pain, as well as something we call dyspepsia, which is where you have this kind of acid, imbalance. And so we're seeing a myriad of symptoms. Some of these things were not known at the outset when we were initially kind of affected by this COVID-19 pandemic. And so it continues to evolve.
Wow, yes, because once again, as in our intro states, we only think of COVID as a respiratory illness, but now you're finding persons with symptoms along their GI tract. So can you talk about the finding of active coronavirus in the stools of infected people with COVID-19, and how does this relate to stool testing?
Yeah, again, so this is something that scientists are constantly around the world that are discovering new things about this coronavirus that has caused such havoc on the world. And so what we're seeing is that patients what scientists are seeing, and what we have not specifically done that here locally, but when you read the medical literature, what you're seeing is that persons who would have had the coronavirus, what we're finding is that they're shedding this in their stool, in the feces. And what they're finding is that even after a patient would have been deemed cleared meaning having two negative sequential nasal swab testings that have come back as negative, they're still finding the coronavirus in the feces. And so there are a lot of the studies that are ongoing now, and what they're finding is that there's a lag time, a significant lag time, that can be anywhere from 1 to about 30 days. You can test this coronavirus in your feces after you would have been deemed cleared with the nasal swab.
And so now that we have this knowledge, is there another level of surveillance that we as a country could be engaging in? Let's say wastewater surveillance. Can you tell us a little about that?
With wastewater surveillance, yes, to a certain degree. So it is actually, when you think about it, it's genius. But of course, there has to be the right elements to that. So, for instance, with wastewater surveillance, if we know that persons are going to be shedding the virus in their feces, it can give public health some useful information in terms of what's actually happening in communities by testing the wastewater or sewage to see, if there's prevalence of the coronavirus, and it's still an RNA testing to do that level of inspection. The limitations with that, though, however, would be for persons who are completely on like a septic base tank. It may not be connected to like a community sewage system. Mm-hmm. And so in those environments, you may not be able to get complete data. And of course, it's not, it doesn't give you a sense of it doesn't give you a sense of the numbers. It just lets you know that, in particular pockets, you can have coronavirus still kind of lurking around.
Wow, it sounds like as time goes on, we find out more about this virus, and we have to find even more creative ways to battle it. Dr. Collie, Doctors Hospital is on the front line of COVID care in the Bahamas. Tell us what strides you've made, and how can people find out about all your services and specialists?
So definitely, as you know, we have been on the front line, as you said, partnering with the public health system to provide initially treatment of very ill COVID-positive patients at our center on Blake Road. Then next, we have entered the realm of testing, once again, to come alongside the public system to provide testing of patients who are suspected of COVID-19 via rapid RT-PCR testing. And next, now, we have started a service called contact tracing and risk mitigation, specifically for businesses where there is any concern that you may have breaches in your environment, as well as risk mitigation in terms of if, businesses want to know how to keep their staff safe, how to keep their businesses safe. We are definitely endeavoring to come alongside and assist in that way as well, too, in order for us to all partner in this pandemic to try to win against this threat that is a public health threat. But we as a private institution want to be as good as, not to say corporate citizens, because we are a healthcare center. And, our motto is we care. And so we definitely want to be able to continue that care even beyond the walls of Doctors Hospital.
That sounds fantastic. I concur and I agree. The Doctors Hospital has been on the front lines of this fight from day one. We've seen it in the media, we've seen it on social media, and we appreciate all of our frontline workers, such as yourself and Dr. Moxey, who's helping us get past this COVID-19 pandemic. Once again, we'd like to thank you guys for coming to Bahamas at Sunrise and bringing us all this wonderful information. We can have you guys on air for hours talking, but we know you have to get back to the good fight. So Dr. Collie and Dr. Moxey from the Doctors Hospital Health System, thank you very much for joining us on Bahamas at Sunrise again.
Thank you.
Thank you, Mark. Take care.
Thank you all for watching us from Bahamas at Sunrise. We'll be right back.